This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Hope you are safe and sound on a snowy and icy Monday morning. This morning, our guest, friend of the show, Dr. Archana Vasudevan, Infectious Disease and Wound Healing with Mon Health. She joins us on the program this morning. Good morning, Dr. V.
Good morning, Dave. How are you today?
I'm doing well. It's been a while since we've talked. How have you been?
Not bad, thank you. Just dealing with this pandemic like everyone else.
Well, we are going to get into a COVID-19 update. We'll talk Omicron, we'll talk masks, we'll talk symptoms, we'll talk vaccines, all of it over the next 25 minutes or so. But first, Dr. V, just remind people a little bit about your background.
I'm originally from India, from the coastal city of Chennai. I did my medical degree in India and then moved to the U.S. to finish my training. I've done my internal medicine residency and then I specialized in fellowship in infectious diseases. My training was in Missouri, in University of Missouri.
And what brought you to Mon Health?
My husband was actually looking for a job in Morgantown, and so we moved here. I was looking for a position here myself, and Mon Health really stood out to me. They have a reputation of top-notch physicians and personalized care, and that was very important to me. And I was also looking for a smaller community hospital where I can really connect with my patients. So I came to Mon.
And as they say, the rest is history. So let's jump into the COVID update. And I think we all hoped that we would not be talking about it in 22, but here we are. So what are we currently seeing as far as the number of cases go here in our community?
So the rates are going up all over United States, but more so locally in Mon County, our rates have gone up significantly, actually, particularly since the holidays. Right now, as of last Friday, the DHHR shows we have 1,079 active cases. In West Virginia, we have about 1,700 active cases, and 846 of them have resulted in hospitalization. About 130 of our patients are on ventilators. And what's illuminating is more than 90% of those on ventilators, which are breathing machines, are unvaccinated.
So even though, and we're going to get into Omicron a little bit more in detail here, the Omicron is more of a contagious, more transmissible. It's still, when we're talking hospitalizations and severe symptoms, whether it's Delta, whether it's Omicron, it really makes a difference whether or not you've been vaccinated and had those boosters, doesn't it?
That is absolutely correct. For the unvaccinated person, it does not matter what variant is going on. For someone with risk factors who is not protected, it can still result in hospitalization and needing breathing support, which is very concerning.
We've heard a lot about, obviously, the Delta variant and now the Omicron variant, which has swept across the country. But what are the differences between those two for patients?
So, first, similarities, both Delta and Omicron variant can cause upper respiratory system symptoms like cough, fever, but specifically with Omicron, the cough and fever seems to be less prevalent, but more symptoms like runny nose, sneezing, headaches, fatigue, and there's been fewer reports of loss of taste and smell, which was one of the first things we were talking about when this pandemic started and when COVID-19, the initial strains were going on. But with Omicron, that seems to be slightly less prevalent. More importantly, Omicron seems to be much more transmissible, much more contagious than even the Delta variant because it has all these mutations on its spike protein. That's the protein that attaches to human cells. And because of all these changes on the spike protein, it tends to increase the chances of infection when someone comes across another person with COVID-19 from the Omicron variant. It can also, it's been shown to evade immune responses, more so in people who may have had prior infection with a different variant but has not gotten vaccinated. Some reports are showing, especially those that came from South Africa earlier, that this variant can cause less severe disease, and that's unfortunately causing a misinterpretation that even if you're not vaccinated, you can get away with just mild symptoms, and that is not true. What is really important is because this is much more transmissible. It's one of the it's more predominant right now in all of US. This is the most predominant strain. So for someone who is not vaccinated with risk factors, it doesn't matter which variant they are infected with. It's a big risk because it can progress to severe COVID. It can result in hospitalization, needing breathing support. So it's really important we get everyone vaccinated. Those who are vaccinated should go on to get their booster shot. We should continue to mask, socially distance. All of the things that we've learned over the last 1.5 years, it hasn't changed. We just need to continue to practice it.
Yeah, that was going to be my next question. Even though the variants change and the mutations in the virus, it seems the same things we talked about from day one. Masking up, social distancing, if you're showing symptoms, staying home, all of those rules and guidelines still apply no matter what the variant is.
That is correct.
Our guest this morning, Dr. Archana Vasudevan, the Infectious Diseases and Wound Healing at Mon Health. Coming up on the other side of the break, we'll talk about masks, we'll talk about vaccines, we'll talk about boosters. We'll do it all in just a moment as Mon Health Talk continues on the voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Archana Vasudevan, Infectious Disease Wound Healing at Mon Health. We're talking about a COVID-19 update this morning. And Dr. V, for someone who may already be experiencing symptoms or may have tested positive for COVID-19, what are your recommendations for them?
So if you are sick, it's important to stay home. That's the first important thing. Evaluate your risk factors, your vaccination status, and talk to your doctors. Your doctors will be the right people to guide you about how to go forward from the point that you've been diagnosed. I've been telling everyone during this pandemic that they need to get a pulse oximeter. That's the little device that goes over your finger. It tells you what your oxygen number is. I've been telling everyone to get one and keep it at home, especially so if you have any risk factors like taking immunosuppressive medications or have heart disease, lung disease, kidney disease, high blood pressure, diabetes, or obese if you're obese, because it's one of the bigger risk factors. So have this pulse oximeter, check it, and report the numbers to your doctor, and they'll guide you. It's really important that you reach out to your doctors right away because unlike there's some things that's changed since last year, some things that haven't. The things that have changed are we have so much more treatment options, but getting them in a timely fashion is life-saving. So reach out to your doctors and let them know the symptoms you are experiencing, the risk factors you have, and what your oxygen number is. Apart from that, if you're sick, get rest, stay hydrated, take over-the-counter medications that your doctor tells you to take. If you're in a household with other people, stay in a separate room with a separate bathroom. It's really important to let your close contacts, friends who you've been with in the last 48 hours, colleagues, let them know about your diagnosis so they can also quarantine appropriately and they can also test. And then if you experience anything like trouble breathing or chest pressure, discomfort, you're feeling confused, anything concerning, immediately get emergency medical care. Follow those things and have a low threshold to reach out to your doctor's office. They will not tell you, please don't call us so many times. Please do call how many ever times you need to. Reach out to your doctors and they'll guide you appropriately about what you need to do, what treatment options you qualify for, and how you can take them.
In terms of masks, there has been a lot of information, a lot of new information put out, especially when it comes to Omicron. So let's approach it this way, Dr. V. What is the best mask I could be wearing? And is it still better to wear any sort of a mask than no mask at all?
Yes, that's a very good question. I'm glad you asked me that today, Dave. So any mask is better than no mask, for sure. There's some data that shows that a properly fitted respirator, so respirator would be things like K95, N95, they provide the highest level of protection against COVID-19. And we've always known that those masks provide better protection, followed by surgical masks. And then least would be a cloth mask, which provides some protection as opposed to no protection at all. But the best mask would be one that you're wearing and not carrying in your pocket, the one that's not over your nose, that's not over your chin, and that's not where it should be anywhere else other than your nose and mouth. So one most important thing, it should be a well-fitting mask, and it should cover your nose and mouth, and there should be no gaps above the mask, no gaps below the mask or on the sides of the mask, and it should not be wet or dirty. CDC is going to come up with some updates about the different kinds of masks and how much of a better level of protection they offer. I think that may come in the next couple days. Initially, CDC has been, so the recommendations about the mask from CDC has been changing since the start of this pandemic. First, they said regular people don't have to have a mask, only healthcare workers need this. But we need to remember this has been an evolving situation, and based on how much information, how much knowledge the CDC has had, they've tried to put on the best recommendations forward. So currently they are coming up with the updated message about what masks work better, but ultimately any mask that's worn correctly gives the best protection.
Talking with Dr. Archana Vasudevan this morning. When it comes to vaccines, what age groups are now eligible to get the vaccine?
Anyone 5 years older, Pfizer vaccination has been approved. So 2 shots, 5 months apart. So the booster has been recommended after 5 months. So for people about 12 years of age, after the first 2 series, after 5 months, they need to get a booster dose. Pfizer's been approved for 5 and older. Moderna's been approved for anyone 18 years and older. And the only thing that's changed recently is the 6-month gap for booster dose and the age group for booster dose. So now anyone about 12 can also get the booster dose, and the waiting period is 5 months. And those with the J&J, the Janssen vaccine, who got it as their primary vaccine, they'll need to get the booster dose after 2 months.
And Dr. V, we've seen a significant number of breakthrough cases, folks who have had the shot, both the initial shots and the booster, still testing positive for COVID. So if I could still get infected with COVID-19, even though I've had the vaccine, what was the point of the vaccine?
So, yes, breakthrough infections after vaccination has been reported. It does occur, but it's much less frequent than infection in unvaccinated individuals. A high proportion of breakthrough infections can be asymptomatic, and that's the most important part, staying outside the hospital. Even if someone has a breakthrough infection, it's much more likely that they'll have milder symptoms, stay at home and recover, than have to be hospitalized and get oxygen treatment or have to be intubated. Omicron variant, one thing that we've recently come to learn is the vaccine-induced immunity the variant seems to evade it more than other variants that we've seen thus far. But this can be mediated with booster shots. What we are seeing in West Virginia is more than 90% of our ICU patients who are needing breathing treatments, who are intubated, they are unvaccinated folks. So it's like someone's wearing an armor, a couple arrows may pierce your armor, but and that's equivalent to the immunity provided by your vaccination. And someone without an armor is going to be like covered in the arrows. It's just a metaphor to think of. And you'll be much more protected than if you did not get the shot. The risk for progression of severe disease is much less is much higher in an unvaccinated individual than in a vaccinated individual. Milder symptoms in more people, we can treat it in an outpatient setting. That way, you don't need to get hospitalized. That would mean less strain in our healthcare systems. So regardless of the breakthrough cases, it's really important to get vaccinated and stay out of the hospital, stay healthier, recover faster. And one more thing I wanted to say is people are under the misconception that with someone who doesn't have any risk factors, they can get away with a mild disease. But the problem is we are still learning about long-haul COVID symptoms. We don't know how many of our patients are going to have fatigue that will be persistent after they recover from the COVID infection itself. We don't know how many of them have problems with anxiety, palpitations, sleep disorders. There was some data that came out from UK that was an online study where they asked people when they felt better enough to get back to work. More than 50% of those with mild to moderate COVID symptoms reported at the end of 6 months that they still did not get back to work, did not get back to their prior level of fitness. So regardless of how healthy someone is, how many other risk factors or previous COVID infection status, get your shots. That's what will protect you.
Dr. Archana Vasudevan, our guest this morning, and we're back to wrap it up after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Got about, Dr. V, we're all out of time this morning. I thought we'd have 30 seconds, but looks like we're only going to have 20 to wrap it up here. So we'll just remind folks, the same guidelines apply: masks, social distancing, get your boosters. And hopefully, Dr. V, the next time we talk, we'll be talking about the pandemic in past tense. Thank you for the time this morning.